these kinds of inventions appeal to me because I like good outcomes. I want my patients to do well. I want their vision to come back fast. I want them to recover as fast as they can. I want them to have no pain. So all these kinds of ideas promote that. I've always been interested in helping people see better. Of course, that's why I'm an ophthalmologist. But specifically, I like good results or great results. So I want patients' vision to be 20/20. One of the problems with cataract surgery nowadays is when you're trying to clean up the last little bits of what's left with the cataract, called the cortical layer, some of those little remnants can be stuck behind. And later on, they'll cause a secondary cataract or an after cataract. You can use a second instrument called the polisher to go in there at the end, but it's pointy and there's no irrigation, and that can cause a collapse of the eye. If you just stick something in the eye and there's nothing to really support it, the eye kind of collapses on it, and that could cause injury inside the eye. So my invention and my idea is to combine that polishing technique with the instrument that removes the cortical pieces. And so you can see in the video, when I'm trying to remove the last little bits of layers, the tip of that device is very smooth and highly polished. There's no texture to it. So you can't use it like an eraser or a polisher to remove the last little bits. That's my idea, is I would like to have that textured so that I could remove and do an exquisite job polishing the back of the cataract, therefore improving the patient's vision, and then later on preventing this thing called secondary cataract. Then looking forward into the future, we're moving more and more from using ultrasound to remove the main hard nucleus of the cataract to using a femtosecond laser to break that cataract up. So that has been FDA approved now for just maybe 18 months. And the idea is the center part of the cataract is very dense and very, very hard. And you have to use ultrasound, almost like breaking up a kidney stone, to remove the bits and pieces of the hard lens. Or nowadays you can use a femtosecond laser, which is a very high-powered laser that will break up that hard nucleus into small bits. The problem now is the laser can break up the pieces down to a smaller bit, but we still have to use some ultrasound. We still have to go into the same instrument to get those last little pieces out. So an extension of the device I just mentioned would be to maybe modify this device and make it kind of an all-in-one device, make it able to suck in or aspirate those pieces of lens, break them up either mechanically or just with the suction, and through a larger port. I think just a larger port than we currently use would help that. And then use that same device to remove the cortex and polish the capsule. So it's sort of a 3-in-1 device, totally eliminating any use of ultrasound energy in the eye. So I think the industry partner that would be ideal for this would be one of these new femtosecond laser companies, and I think any of them would be interested in partnering with Wake Forest Innovations so that we would make the device better. I know that they would have research facilities, we have design facilities here, we have prototype capabilities, and I think between our collaboration on the idea and their ability to see how it would fit in with their current device, we could come up with a very good solution to make modern cataract surgery even better for the future.